Dr. Garrity, this is me, Elizabeth, and I am going to do my second video demonstration that focuses on treatment for the different types of dysarthria. So the first one that I'm going to do is I'm going to look at phonetic placement, and so with this treatment task, it works on or targets the imprecise articulation that is typical of multiple types of dysarthria. So for this one, if Shallie was having problems with saying the B and the F sound, so I could teach her, okay, Shallie, with this sound, it's the B, and you're using both of your lips, and you're putting them together and then forcing air out. B. Exactly. What you've been doing is you've been saying, so you've been biting your lips. So really feel and focus on putting them together when you're saying words like bat or bug.
Bat. Bug.
Exactly. So that's the first one. Next, we're going to look at contrastive stress. This also targets imprecise articulation. So with this task, we're going to look at some pictures, and I'm going to purposefully say one word wrong and then have Shallie fix it and emphasize the correct word. So for this one, let's look at this picture right here. So you're going to repeat the sentence back to me, emphasizing the correct word. So, is the man eating a banana?
No, the man is eating a strawberry.
Good. Is the boy eating a strawberry?
No, the man is eating a strawberry.
Good. Is the man cutting a strawberry?
No, the man is eating a strawberry.
Good job. And with that, we're emphasizing that correct word and putting stress on that to let people know what we're looking at.
Okay.
So with the next activity, we're looking at minimal pairs. And so this is changing one phoneme in a word. So, for example, it would be emphasizing the different part of a word like flower, power, and emphasizing the two different phonemes. So can you read this list for me, Shallie, and really emphasize the part of these two words that look really similar? Emphasize that different part.
Okay. Man, men, fish, fist, cat, mat.
Good job.
Spoon, spun.
Good job. I really heard those differences, so you're doing great. So the next activity we're going to look at, and with minimal pairs, that's also targeting the imprecise articulation that is typical with dysarthria, so with spastic and flaccid dysarthria as well. So next we're going to look at prosody, and so with this, we're going to really emphasize changing pitch. With dysarthria, a lot of people have trouble changing their pitch and moving up or down. That's typical of normal intonation and prosody when we're speaking and having a conversation. So for this, we're going to start really low, and I want you to say ah as low as you can.
Ah.
Good job. And with this, there's a really neat app that we can use that just shows what your actual pitch is, so we can show them the low number that they had and then tell them that we're going to work our way up. And now I want you to say ah as high as you can. Ah. Good job. See, your number registered at 415, so that's really high. And your first one was really low at 170. So we're going to work our way up and try to increase just a little bit each time, like you're climbing stairs.
Okay.
Okay? So you can see your numbers went up a little bit each time. So that's a really cheap and tech-savvy way that you can include technology in your sessions when you're working on prosody. So next, we're going to look at resonance, and this is really focusing on increasing our loudness. With dysarthria, a lot of people tend to have lower respiration, and so they have trouble with that, and they can't increase their loudness. So visual feedback is helpful with this as well, but we don't have that technology here, so we're going to just base it on what we hear in the normal session. So, but it's not necessary to have the technology, which is great. So I'm going to read a sentence, and then I'm going to say it again louder. So normally I would say, I'm so glad it's summer. And now this time I'm going to say it a little bit louder. I'm so glad it's summer. Okay. So now I want you to read this sentence.
My dog is so cute.
Okay, now I want you to say it again a little bit louder.
My dog is so cute.
Exactly. So with that activity, we're increasing that loudness to really get our message across better. So with dysarthria, we know that all of these areas are impaired with both spastic, flaccid, and mixed dysarthrias. And so any of these would be beneficial based on what your client needs in a session, with whether that's imprecise articulation, resonance, or prosody. All right. Thanks, Dr. Garrity.
Bye.
Bye.